I hope all of you are doing great. Um, this is your SM again with a cup of coffee, and it's been quite long that I've seen you guys or made a video because the schedules are really tight. Clinic cases, workshops going one after the other, and I could not make a video. But today I have some interesting information to share with, so I made a small video. I was doing a full mouth rehab case, and one of the tooth prep, right lower 747, the occlusal surface of that tooth, one tooth, was slightly superior to the occlusal plane of other teeth. So when I made a scan and sent it across to the lab, my digital lab technical specialist or expert, Mr. Pranay Rao, he came on call and told me that this one tooth is slightly above. So can we make some modifications for that one particular tooth? And I thought, okay, yeah, I mean, this is a genuine thing that he was trying to communicate with me. So I said, no, I cannot call the patient back because the patient is traveling and coming every time. So I wanted him to try one small thing. I told him, as I've sent you the scan, first try to print uh, the cast of that section, only that section where we need to do modifications. And I've told him to make a splint out of it. What is a splint? It's a splint with an open window. You can use a patent resin for it. You can use a cold cure acrylic resin for it, or you can use a regular soft splint that we use for SX retainers. That also you can use it, but it should have a window. Now, what do I mean by that? Now the modifications would be done digitally, and once the modification is done digitally, the cast is again printed out. Now we make a splint to that level where the modifications are done on the cast, and we use it on with an open window, and we use it on the pre-op. I mean the scan which I've sent prior to it without modifications, we use it on that. Now, whatever is projecting out from that open window of the splint, we can keep it intraorally and reduce the projected portion on the occlusal surface. This can be done on the labial, this can be done on the occlusal, this can be done on the proximal, this can be done on the palatal or lingual. But the window has to be on the respective side, whichever side you are doing modifications on. Try this method. This might help you in case you have forgotten to get the plane down, and your lab technician again communicates back saying that we need some modifications. Rather than arbitrarily reducing the tooth or prepping the tooth again, you can use this method where you will be exactly prepping the tooth as you want according to the digital modifications that have been done in the lab. I hope this small video helps you all. Cheers.